Good morning. Welcome to today's Community Connection on Stages of Grief. I would like to introduce Brenda Newton Fox, Associate Clinical Social Worker. Ms. Fox began her journey with Community Hospice in 2015, touching lives and providing support to terminally ill patients and their families. She currently works in Hope Counseling, meeting the needs of people with family, mental health, and behavioral issues. She's worked and enjoyed a rewarding career in the field of substance abuse and mental health for over 25 years as a program manager, providing services in multiple capacities up until her retirement in 2013. She obtained her graduate degree in social work from CSU Stanislaus, and she's also a certified alcohol and drug counselor too. Her great passion is bringing healing to people who have been through a traumatic, stressful experience. Just a reminder, you can enter questions into the chat box, and the video is being recorded and may be found at Community Hospice YouTube channel. Ms. Fox, whenever you're ready.
Okay, so thank you, Priscilla, for that warm welcome, and welcome everyone today. I find it an honor as well as a privilege to be able to join you today and to be able to talk about these stages of grief. And so when we talk about grief, in my readings, I came across this quote from Dr. Catherine Shear. And it just touched me, so I hope it touches you as well, to be able to kind of put that grief into some type of compartment so that it could be easy or make it easy for you. Catherine Shear, she is a professor of psychiatry at the Columbia School of Social Work. And so a lot of her work is on anxiety and also on complicated grief, which is prolonged grief work. So grief is the form that love takes after someone you love dies. The point isn't to put these feelings behind you, although that's not possible or even desirable. The point is to gain perspective and help grief find its rightful place in a person's life. I just that touched me. So how grief can affect you? You know, when we are grieving, there are so many symptoms of grief, but they present differently in everyone. So as you know, when each person grief is different for every individual. You know, people grieve at their own time. One person may, be grieving while another person can grieve in a totally different way. And it's mostly how you're able to cope with it. And so the symptoms of grief present differently in everyone. They can manifest emotionally, physically, and or socially. So grief symptoms, sometimes they include when you're grieving, you get headache, stomach aches, loss of appetite. So when you're grieving, you just don't want to eat, Sometimes you can have difficulty sleeping, and along with that can come nightmares. For so many, there's isolation. You are grieving and you just don't want to be bothered, or you just don't want to be around anyone, or so you isolate yourself. You even have a fear of death as well. There's blaming yourself, so once your loved one is gone, you blame yourself. Some of those shoulda, woulda, if I could have, there's poor concentration, people around you are talking and you're just unable to focus and follow the conversations that are being taken place. And then anger sets in, a lot of anger, irritability. Along with that sadness, depression sets in. And then you can even question some of your beliefs. You get to where sometimes there's low energy and you get fatigued. There's also some normal grief reactions. When our loved one dies, sometimes we feel like we're going crazy. What's going on? I can't handle this, As we said, difficulties concentrating, you feel so sad, depressed, irritable, frustrated, sometimes, oftentimes misunderstood. You can experience anxiety, being nervousness, fearfulness, feeling like you just want to escape, have those out of body experiences. Oftentimes, a lot of guilt and remorse sets in. And of course, you feel numb, you have a lack of energy or just a lack of motivation to want to do anything. So the 5 stages of grief model, it was first introduced by Elizabeth Kubler-Ross in her 1969 book on death and dying. The book was inspired by her work with terminally ill patients. Today, many sources have cited 7 or more stages of grief, but for this presentation, we will be just focusing on the 5 stages of grief. And those 5 stages are denial, anger, bargaining, depression, and acceptance. So in general, most individuals experience most of these stages, though in no defined sequence. So after a loved one, you're faced with the reality of their impending death. The 5 stages have been adopted by many as applying to survivors of a loved one's death as well. So, when you have a loved one and they have been diagnosed or have been given a terminal diagnosis, they also go through a grieving stage. And so they can go through these 5 stages of grief as they are nearing the end of their life. And so for us who are left behind as survivors, we go through the 5 stages of grief to be able to come into acceptance of them no longer being in our life. So stage 1 is the denial. So when you first, or you could be there with your loved one when they pass, and or someone can give you the news that your loved one has passed. So that first stage of grieving, it helps us to be able to survive the loss. So we go into this denial or a shock. And so in this stage, everything around us, it just becomes meaningless and overwhelming. It's like our life just makes no sense. We're in this state of shock. We're in a state of denial. So the denial and the shock, it helps us to be able to cope and make survival possible. Denial also helps us to pace our feelings of grief. So as you accept the reality of the loss and start to ask yourself questions, you are unknowingly beginning the healing process. And that's stage 1. Then we go into stage 2. And stage 2 is anger. So it's like, why is this happening to me? It's not fair. This stage is where reality and pain emerge and intense emotions are expressed in anger and rage. So it's like we just don't know what to do. We've lost our loved ones and we just become so angry until a lot of our anger, if we aren't careful, we can direct it at others. Sometimes our anger is aimed at objects, aimed at strangers, people just that we don't know, family, friends, or loved ones who has passed. For many, there's an anger at God. There's an anger at whoever your higher power is. And if your loved one was in the hospital and passed there's an anger at the doctors. We become so angry and feel like the doctors could have done more, or why they didn't try this, And so our anger gets directed at them. We have these feelings of resentment and guilt, which are common emotions in this stage. Stage 3 is that bargaining. So before a loss, it seems like you do anything if only your loved one would be spared. Please, God, please, I'll do anything, spare him. I'll do this. We start bargaining, hoping that, God would spare our loved ones. But then after a loss, bargaining may take the form of a temporary truce that you try to make deals. So, you make deals with yourself, you try to make deals with God, God, if only, you could have taken me, or, so all this, you set up all these deals and all these things that you want to try to bring that person back or wish away the situation or the incident that had just happened. We become lost in a maze of if only or what if. Regret becomes inevitable. Guilt is often bargaining's companion. In this stage, guilt a lot of times sets in because you kind of wish that if only, or I should have, or would have, then you feel guilty. So we would do anything not to feel the pain of this loss. Stage 4 is where the depression comes in. It's the point that you tell yourself, what's the point of going on after the loss? So when reality sets in, that bargaining starts to turn into depression. And the individual, you isolate yourselves, you spend time grieving, you spend time crying a lot, there's a feeling of you have this sadness because you understand that this person is gone and will not come back. Depression is a precursor to acceptance because the individual has come to recognize their loss. So while you're in this depression, I always encourage to try to be careful. You don't want to stay long in this depression because sometimes in this depression, oftentimes there's thoughts of suicide. And so if you ever find that you're in a state where there's depression and you can't get out of that and you're thinking about suicide, immediately pick up the phone and try to get the help that you need. And our last stage is the stage 5, which is acceptance. So it's going to be okay. When you get to this stage of acceptance, it's kind of like it's the final stage, and the individual, you kind of know, you come to accept the loss, the reality that your loved one is physically gone, and you recognize that this new reality, this is the permanent reality. You come to understand the situation logically, and they have come to a terms with the emotional, with the situation. So what happens in this acceptance stage, you come to a place where you understood that they're gone, they're not coming back. So, I know that I need to move on with my life, but how do I move on with my life? And so at this stage here, you start learning how to plan for new activities, for new ventures. That hope sets in now, and you know that there's a new beginning, a new life for you, and that new life probably will not entail or will not have your loved one in it, but it's okay. It's okay for you to move on. And so there's 5 things to keep in mind with grief. We can never get over a loss. The only way to deal with grief is to experience it. And grief work is hard. Anytime you going in and you're talking about your loved ones and you're putting in that work, it's hard work. It's not easy because you're in each stage that you venture through. Of course, you're moving through those stages. When you're ready to move through them, there's coming to acceptance at each stage, and there's opening up those wounds, that you have tried to bury. So never compare your grief to others. The most troubling grief there is our own. Successful grief work is not done alone. Isolating ourselves make the process complicated and it can delay dealing. How we grieve is strongly influenced by our culture and also our spirituality. Thank you. Are there any questions?
Hi, thank
Hi
you
there.
so much for that. We do have a couple of questions here in the chat box. And the first one is, how long does it typically take for people to experience all 5 stages of grief?
You know what? There is not a time limit. When you are grieving and you go through these stages of grief, you don't necessarily go through these stages in order. You can just go through them wherever you at in the stage. And so once you get into them, there's not a time limit. You know, you may find yourself in stage 1, you know, for a while, and then able to move to another stage. So there's not a certain time limit that you can put on the grieving process.
And then the second question here is there anything that people can do to speed along the process of grieving or healing?
I think there is nothing that you can do to speed along the process. I think it's going through the grieving process. It's an individual thing. You can't speed it up. It's just it's part of grieving. You know what I mean? So it's where you at with your grieving, and I don't think it could be speeded up or hastened. I just think it happens naturally, and you go through each stage naturally. And that doesn't mean you have to always go through each stage. People skip stages, you know, but you can't speed it up. You know, you just have to. You just have to feel it, and you have to just know where you are at in the grieving process, and know that it's when you come to your acceptance at each stage.
Very good. Thank you so much.
Thank you.
Thank you. If anybody in the audience needs additional resources, you can contact 209-578-6300, or you can visit our website, hospiceheart.org. I'm going to invite you all to our next presentation, which will be on July 27th at 12 o'clock on how to have a difficult conversation. Just a reminder that this video is available on our Community Hospice YouTube channel. Thank you all for joining.
Thank
Bye.
you for having me.
Thank you. Bye-bye.